Gonioscopy is to examine all these structures. Normally the angle cannot be seen except by applying a special lens, because rays coming from the angle cannot reach outside because of a phenomenon known as total internal reflection. Rays cannot pass outside. When we apply the gonioscope, the cornea is cancelled from the optical point of view and rays can reach to the outside. We have two main types of gonioscope. The first is the Goldmann lens. This is the anterior view of the lens, and this is the back surface where it is applied on the cornea. After putting anesthesia, we have to fill this cavity with methyl cellulose to exclude any air bubbles from the way. Now we pull the lids to open. We use the edge of the lens to support the lower lid margin. With the other finger we pull the upper lid, and gradually we apply the lens and let the upper lid to come down. So this is how, again, fill the cavity, open the lids, use the lens to support the lower lid margin. The image seen is reversed. When we put the mirror down, we examine the 12 o'clock position. But as you notice here, not everything is reversed. It's not like the indirect ophthalmoscopy where everything looks upside down and right to left. Here, this is not reversal on the right to left. As you can see here, the 1 o'clock position, we have an iridectomy. We see it on the same side. On the 12 o'clock position, we have some blood vessels. We see it on the same side as it is in the upper position. The second lens used is the Zeiss lens. This is the anterior view of the lens. This is the back surface of the lens. Here, this back surface is not very curved, it's flat. So we don't need to apply any methyl cellulose between it and the cornea. We have 4 mirrors. We can apply it directly on the surface. But we need a cooperative patient, because the patient can pass his eye into any direction. So all the time we have to instruct the patient to look straight ahead. Once again, these are the 4 sides of the 4 mirrors of the lens. No methyl cellulose, just directly apply the lens on the surface of the eye. The advantage of this type of lens is that we can do what is known as indentation gonioscopy. If we use the lens, it's small in diameter, flatter than the cornea. If we push the cornea back, the aqueous here will also push everything back. So if we have a case of a Bombay iris like this, and if there is no synechia and we push everything back, the angle will look opened. On the other hand, if there was a peripheral synechia, the angle will remain closed. As here, we are pushing this side, the angle remained closed because of actual synechia, while here the angle become open, so it was just a position between the iris and the back of the cornea. In this example, this angle, when examined by the Goldmann lens, it looks as if it is a closed angle. But on indentation gonioscopy, we could see structures, so it is just a position and not an actual synechia. Now, what are the